Their therapy assistant is available 24/7 on demand whenever they want. They've got somebody that's always accountable and supporting them through their cognitive journey.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster here at AAIC in Philadelphia with Paul Campbell, CEO and co-founder of Moneta Health. Paul, great to see you.
Good to see you, Logan.
Let's talk about Moneta. What have you built? It's a relatively fresh company, right?
It is. So Moneta is a brain health company, and our mission is to transform the standard of care for the treatment of cognitive impairment.
Okay. One thing I love about Moneta is your use of the telephone, a use of voice to voice, and the combination of human-to-human interaction plus AI. So kind of walk me through, let's say my mother is on the platform. What's the patient experience like?
Yeah, so what we've built is really sort of old school meets new school.
Okay, I like that.
The standard telephone as the primary user interface or user experience for the patient to engage both with the live therapy with the Moneta therapist and the on-demand therapy with the voice AI agent that we call Mona. But all of that complexity is hidden because we're dealing with today's population of older adult that is dealing with these challenges of cognitive impairment. The last thing we wanted to create was a barrier to access, to scale, and to equity. Now about the experience, really, step one is an assessment that gets done between your mom and a Moneta therapist, delivered over the telephone. Takes about an hour. Then that informs the care plan, which is the series of on-demand activities that are delivered through 3 phone calls per week that take about 20 minutes. And then at the end of the month, sort of assess, see where the patient is on their journey, and then they either go into another month or they get discharged into our prevention program.
How much of the innovation around Moneta is the actual modules that you go through, and how much of it is the sort of tech stack that kind of knits it all together, the Mona plus the phone calls? Are you using new methods?
So we are using, from a clinical foundation, we're using an existing evidence-based protocol called Cognitive Rehabilitation therapy, sort of like physiotherapy for the brain. But what we've done is translate that into something that is highly accessible using the tech stack build of the old school and the new school.
So you don't have to confirm that this modality works. So you're using cognitive rehabilitation therapy. Okay, so we know that works, but you're delivering it in a new way using AI to more accessible.
Exactly.
Okay. Talk to me about your go-to-market strategy involves working with Medicare. Tell me about how that came to be. That can be difficult for a startup to work out, and why that's important for you.
Yeah, so my co-founder and I, Jen Flexman, when we pivoted to cog rehab therapy, sort of both of us have been in the digital health space for a while, and one of the key things we identified was who is going to be the payer? Who's going to buy this? We know there's
First question.
We know there's patient demand, but there's been a lot of great innovative companies that have just failed to get liftoff because they hadn't figured out the business model. So cognitive rehabilitation therapy, there are existing codes that we are able to build. And so when we built our initial product, we wanted to test and prove that we could qualify for Medicare reimbursement. So once we checked that box, then we took a state-by-state approach to distribution, working primarily in neurology deserts. So these are the places where there's high patient demand, but limited both primary care and neurology capacity. So that's why we're operating in states currently of Nevada, West Virginia, Montana. So those states where there's a great need, older population, but just not enough capacity, and we fill that gap.
Sounds like you're being very strategic, which I'm taking is from your previous experience. You've been a CEO before.
Yes.
You've led tech companies, health companies. You guys, this is not your first rodeo. How are your older patients responding to the AI side of the business? Mona.
So what's most exciting to us about that is, there's a quote, and I'm going to mess it up, but basically, like, great technology is invisible, right, to the user. And our patients, while they know that they're engaging with Mona, this on-demand agent, it's really in the background. What they see is that their therapy assistant is available 24/7 on demand whenever they want.
Yeah.
And the real connection point is their relationship with their human therapist who gets all of the feedback from the on-demand therapy engagements, and it ties it all together. So they just think of Mona as sort of part of a whole solution,
Yeah.
but they've got somebody that's always accountable and supporting them through their cognitive journey.
Okay. How are the neurologists responding?
So that's been also really something that we've been very encouraged by. They identify a huge gap. Case in point, we're working with a health system out of Montana,
Yeah.
and they're responsible for about a quarter of the population, about 270,000
Wow.
patients. Their neurology department for the whole health system is a couple of people.
Wow.
Yeah. So when he learned about what we were doing and their team learned about what they were doing, like, this is filling this huge gap, because we want to intervene early, and we also want to be able to provide this longitudinal care so that when they do need those specialty services, they're there.
Like the therapies we're hearing about here, and
Exactly.
this group is very excited about. Remind our audience, like, how many people are bumping up against mild cognitive impairment? Like, how big is that population?
Unfortunately, it's huge and growing.
Yeah.
There's about 20 million older adults, 65 plus, who are experiencing the early stages, so mild cognitive impairment, or the early stages of a form of dementia, whether that be Alzheimer's, which this conference is about, or into dementia triggered by a traumatic brain injury, post-acute stroke, Parkinson's. So there are a lot of causes to this, and as our population ages, we're just going to see those numbers grow. And we're not situated, which is the reason why we're so excited about all of the innovation that we're seeing here at this conference, addressing the whole continuum from diagnostics through to late stage care.
Traditionally, there hasn't been a ton of hope in Alzheimer's in terms of, like, well, what can we even do if we have the knowledge? How effective is cognitive rehab?
So the evidence is very strong and growing. There was a recent sort of like meta-analysis, the Cochrane Review, published in 2023, that sort of took the next step of looking at all of the implementations of cognitive rehabilitation therapy. Bottom line, recommendation that it should be standard of care, and that it is effective, and in many regards it's as effective as many of these disease modifying drugs in terms of promoting quality of life and independence and prolonging the decline.
Yeah. How much of the rehab has to do with social issues, loneliness, social connectivity?
Yeah, so there's really sort of three legs of the stool in cog rehab. The first leg is the cognitive training component. So really understanding where the deficits are for the patient is that short-term memory, procedural memory, executive function, and that there are exercises, really based on neuroplasticity that can help address those needs. The second leg of the stool are those lifestyle components.
Yeah.
There are risk factors that really impact one's cognitive journey: sleep, exercise, nutrition, social connection, stress management. And so we have exercises that address those. The third leg of the stool, which is really kind of how the patient takes this into their daily life, are compensatory strategies. Think my glasses are a compensatory strategy for my declining eyesight, right? So compensatory strategies can be internal or external: verbal rehearsing, creating lists, putting them up in the home. And so we help both the patient and the caregiver across those three legs of the stool, and that's what makes up cog rehab. And I think, like, sort of the killer app around the cog rehab is that it's all focused on functional goals and outcomes. I want to make a cup of coffee in the morning.
Increasing quality of life for that
Exactly.
individual.
Yeah.
I love it. Paul, well, thank you for taking a minute with me. I love that you are not only bringing some relief to these patients, but also these neurologists who are, burning out from having to deal with this growing population, don't have the tools they need. Smart business model, working with Medicare, with existing codes. So excited for what you're going to do next.
Thank you, and we're really, really excited to be part of the Startup Health Alzheimer's Moonshot. It's a great community that is collaborating, and it really is going to take a team to drive the impact that we want to see. So thank you,
Awesome.
Logan.
Good to see you, Paul.
Cheers.